Hi, Dr. Jaclyn here with Let's Move Physical Therapy. And the topic for this video that I wanted to discuss is regular check-ins. So my goal is that one day Let's Move Physical Therapy will be like a dentist's office, right? Because you go to get your teeth cleaned, typically in a perfect world, every 6 months, and you do your check-in, be sure everything's on point, get your information that you need for the next 6 months, and then go about your day. This is a topic that is very passionate to me because I have found a lot of, especially new mommies, are not always given the correct or enough information on typical gross motor development. And this is something that I would like to provide to the moms if they're willing to come in to get the information. And this is also something that I learned why early intervention is so important, which is a free service to everybody in the state of Nevada if they would like to do an evaluation with them as well for all the different categories for development. And that is because if you're able to come in at 6 months, when your child's 1 year old, 18 months, 24 months, and then at their 3rd birthday, 4th birthday, 5th birthday, and so on and so forth, I can provide you with the gross motor expectations for that next group of time, but also we can catch different things if they start to be an issue. And the worst thing that happens is you come in for an evaluation every 6 months and you or your kid are on point and you don't need me at all, but you leave here more educated and understanding of your body and therefore improved body awareness or improved self-awareness and knowing how to handle yourself through space in a way where you actually prevent injuries because you have the knowledge and the education to go forward and help yourself. Also, one thing that I wish was better or that I could provide is spotting scoliosis faster, especially when kids hit puberty, because that often goes unmissed until later when things are unfortunately very painful. And that is something I would like to be able to provide the community, is spotting those things faster, or at least to the point you can say, hey, I was checked when my kid was 12 years old on this day, and everything was straight, or she was able to walk, or he was able to walk with a normal pattern. The feet weren't turned in, the feet weren't turned out, and then this happened 10 months later. So what happened in that time frame? So at least you have a frame of reference of knowing on this day and time we did this and you were at these skills. Another important example of this is, okay, I brought my child in to do a gross motor assessment when they were 18 months old. He could walk, do half kneels to stand on one leg for 3 seconds, started jumping maybe a little bit, and then when I came in when they were 2 years old, all of a sudden he cannot walk, he cannot stand on one leg. So why is there an all of a sudden regression of skills? And I think that is really important to notice. I have seen that happen so many times, and the sooner we can catch that, the sooner, one, you probably need to continue with therapy at that point, but 2, we can get you to the specialist that you need to get to figure out, why was I walking and now I can't. And another really powerful example of that is sometimes kids when they're 14, 12 to 14 range again, they can get off the floor and then all of a sudden they can't get off the floor anymore. Or they're walking at school and it's this really intense waddle walk and they can't keep up with their peers. They start falling all over the place. These are the things that are really important to catch. Probably 9 times out of 10, you would come in for this recheck and I would have nothing that exciting to tell you. But if you're that 1 out of 10 people, how important would that be to you to find that out so that you can get your kid or yourself the help that they need to give them the best chance at success? That's just a very important topic to me, and that is something that I continue to work towards because I really think education and your own self-awareness is so important so that you can be your own advocate And two, when you come for your evaluations or your treatment sessions, we're, typically one-on-one here. So it's just me and you talking for, that 30 to 60 minutes or however long we determine the session to be. And so I get to learn a lot more about you than when you go to the doctor's office, for a few minutes. And that's not their fault at all. That's just how the system is set up. And so I would like to be here to help the different mommies and daddies and caregivers, for people of all ages to do those types of check-ins.